Meeting of the Union County Board of Commissioners, and we will call this meeting to order, and as is our custom, we will begin with our invocation led by Commissioner Rushing.
Thank you, Mr. Chairman. Join me if you'd please. Lord, we come to you in troubling times. We come to you when our country is testing uncharted waters. We pray that you would lay it on the hearts of every citizen of the United States, Union County, North Carolina, that any senseless crime, any drug overdose, anything that unnecessarily jeopardizes someone's health or could put somebody in a hospital bed takes up one resource that we may need for somebody else that's elderly that contracts something that we need resources for. We pray that you would be with us. We pray that you would have mercy on us. And we pray that the decisions that we make would be to better that end. In your name we pray. Amen. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We have several recognitions this afternoon. We'll begin with the introduction of our new Veteran Services Officer, and Mr. Manager, I'll turn that over to you.
Hi, good afternoon. First of all, I wanted to thank you for the approval of a new VSO position. It's so important to our office and to our veterans of Union County that we have the assistance that we can get. And I thank actually Mr. Helms as well. I know he was a big pusher. He's a huge advocate for our veterans, as all of you are. Mr. Tarzinski joined us January 6th, and I apologize for the late introduction. We've had one VSO out on emergency leave, and unfortunately, Mr. Tarzinski had a death in his family, so we're just now here to introduce him to you, and I'm going to give the mic to him.
I know this is my first time getting a chance to speak to some of y'all, but I spent 28 years in the Army. I'm originally from Union County, so this gives me great pleasure to be able to come in and work with the staff in the Veteran Services Office to help continue serving the veterans of Union County, because I just can't think of anything else I'd rather be doing right now. So thank you very much.
Thank you. Next item is our North Carolina Certified Local Governmental Finance Officer Certification. Since 1985, the North Carolina Government Finance Officers Association has offered a program of voluntary certification for local governmental finance officers. Its purposes are to provide greater service to the public and the management of local government, recognize achievement of an established level of competency and proficiency among finance officers, promote continuing professional development of finance officers, and enhance their professional image. To those who meet the program standards of experience, education, and examination will become a North Carolina Certified Local Governmental Finance Officer.
Miss Debbie Cox is going to talk to us about that.
And I would like Amanda Alston and Beverly Lyles to join me. This is a very prestigious certification, and the candidates for certification, they must complete a very rigorous educational requirement, as well as pass an exam on government finance. Amanda has been with Union County since 2011 and is an accountant on staff. This is her first certification. Beverly has been with Union County since 2000 and is a senior accountant on staff. She became certified in 2015, and this is her first 5-year renewal. Please join me in congratulating both Amanda and Beverly on their accomplishment.
number 6 is Procurement Division 2019 Sustained Professional Purchasing Award.
We have Ms. Cheryl Wright with us. Cheryl, would you like to come to the podium?
Yes.
Thank you very much. This is a very prestigious award that is given to procurement departments in North Carolina that apply and meet a myriad of criteria. The procurement team joined together and we submitted our application. It was reviewed by the Carolinas Association of Governmental Purchasing. I want to commend this team for being able to meet all of that criteria while doing the work that we need to do for the organization. If it is okay, I'd like to invite Vicki Watts up, who helped lead us in the application process, Trina Horn, and Ava Strawn to join us in accepting the award from you commissioners. And this is our 3rd year in receiving this award. And could you give us a round of applause?
And that takes us to, I believe, our employee recognition. Here we go. Oh, I'm sorry. Certified Local Government Purchasing Officer Certification.
Cheryl, would you like to talk to us about that also?
Yes, thank you very much. So this award, or certification we should say, is given to certified purchasing officers in the organization who meet a rigorous criteria through the UNC School of Government, as well as a very rigorous examination. Vicki Watts received her CLGPO certification in early March. Vicki's been with the county for 1 year. So to be able to join our organization, complete a myriad of projects and still study and take classes for this exam and pass the exam is very major. So please join me in congratulating Vicki Watts on receiving her CLGPO certification with the Carolinas Association of Governmental Purchasing.
Get the agenda on the teleprompter up there, sir. Okay. So now we're on number 8, correct? This is our employee recognition, where we recognize those employees who have completed a tenure of service, and this is going to be a fun one. Jessica Cross with 911 Communications has 5 years. Jessica Husky also with 911, 5 years. Jody Harvey with Public Works, 5 years. Kevin Susevich with the Sheriff's Office, 5 years. Daniel Stroud, also with the Sheriff's Office, 5 years. Jessica Gaddy, 5 years. Karina Santiago with Social Services, 5 years. Ellen Distante with Tax Administration, 5 years. Alan Teleshitsky with Tax Administration, 5 years. With 10 years, Eugene Henderson in Human Services Business Ops. And then with the Sheriff's Office, all with 10 years, we have Megan Kimball, Dustin Medlin, Pilar Nevis, Johans Prince, Desiree Blackman, and Teresa Casamillas. Then with 15 years at the library, we have Elena Wolf, and with Social Services, Deborah Patterson. So we congratulate those employees. Thank you for your service to Union County. Our next item is number 9, a recognition by Sheriff Cathy.
Thank you, Mr. Chairman, for allowing me to be here in front of the county commissioners. I want to try to read this. You know, I don't stand up here and read too well, but if I skip, you got a copy of it. I want to take a moment to publicize and recognize a recent outstanding collaboration and work by the county employees and especially Union County Public Works. In the early morning hours of Friday, March the 6th, 2020, we experienced a total water outage at the Union County Sheriff's Office, which was a main water break at the office there in front of Wingate. Thankfully, the outage occurred while the inmates was asleep, did not occur while they were awake. Once County Manager Mark Watson was aware of the situation and the potential impact of this huge cost it might be to the county, especially in the jail staff, inmates, the danger, Mark Watson immediately activated appropriate county personnel and emphasized the urgency of this situation. And what he did was Public Works, he alerted Public Works and rolled out Junior Honeycutt and all of them to find this water leak. Within a short period of time, Union County Public Works deployed, quickly located the source of the water main break. Public Works staff worked the outage primarily that affected the Sheriff's Office, Ag Center, and other businesses in the area, just small businesses and residents. Public Works worked diligently through the night and cold weather to repair the water break, restoring the service. And the interim emergency management, Don Moyer, Assistant Management Coordinator Andrew Ainsley made arrangements for several bathrooms. We had to bring in porta-johns to the bathrooms because the inmates didn't have bathrooms. We didn't have water for them to drink. Wingate Fire Chief Travis Stegall was on standby with water. So the coordination of buying water, transporting it to the inmates, we had to give them a lot of bottled water. So it was very important that the county worked together to provide this service. In a timely manner, professional work accomplished by several people working together in the middle of the night averted a possible safety risk to the county jail and the public if we'd had to move those 250 inmates to some other facility. It would have been a tremendous undertaking and tremendous cost to the county. If we'd have had to move them, it would probably have cost us for 250 inmates somewhere between $45 and $75 a day to house them if we hadn't got this water main fixed. So tremendous savings to the county. I'd like to acknowledge the credible work that our staff did, the jail staff during this period of time. They were all called in and all worked overtime to get it done. And this, let me say, it's an honor to serve as the Sheriff of Union County. And I remain convinced that the citizens of this county are fortunate to be served with the most dedicated county staff in this great state. You've got a copy of what I tried to read to you. But let me tell you this. They fell out in cold weather. The directors were down in those ditches digging. It was a massive effort to get that water repaired. And we prepared 2 meals with water we carried in from Walmart. I mean, it was just a tremendous undertaking and very successful, and it saved the county a lot of money. And we felt like we need to show some acknowledgement to the Public Works and Mark Watson for realizing that, how important it was. And thank you for letting me come.
Thank you, Sheriff. Ms. Lancaster?
Yes, sir. If the board would, we'd like to move the public health preparedness item ahead of consent, if that is okay with you. And I will move forward with some comments to introduce that item.
Necessary to suspend the rules to do that? Move that one item up ahead of consent? Okay. All in favor, say aye. Aye. Carry on.
Thank you so much, Mr. Chairman, board members. I'm going to provide some introductory remarks prior to having Dennis Joyner, our Public Health Director, and Dr. Stephen Keener, our Medical Director, give you a more specific health-related information regarding COVID-19. As we shared with you by email yesterday, our Emergency Operations Center is open and is operating daily 8 a.m. to 8 p.m. We plan to evaluate this schedule later in the week and modify that if necessary. The EOC is staffed with county staff, sheriff's office staff, staff from Monroe Police Department, Union County Public Schools, and other community partners. Additionally, we have operationalized a Joint Information Center, otherwise known as the JIC. The JIC provides our communications staff a centralized location, both physically and virtually, to work out of and leverage the communication resources from our partner agencies. Our towns, hospital systems, colleges, UCPS, and others have been willing partners in this JIC operation. This allows us to ensure consistent messaging during this time of increased uncertainty. For both the EOC and the JIC, I want to thank our departmental staff, sheriff's office staff, municipal law enforcement, UCPS, and other partners for coming together quickly over the weekend and being willing to share resources, and we appreciate everyone's willingness to work together in this effort. We are also working to staff a hotline for COVID-19 questions in the community. We hope to have this fully operational tomorrow. This hotline will be staffed by UCPS school nursing staff and our UCPS collaborative staff, and we are truly appreciative to UCPS and those staff for their willingness to work in making this resource available to our community. Other items that we are doing as an organization to be prepared include working with our departments to identify changes that we can make in our operations while minimizing impact to our customers. These include looking at options for teleworking and staggered work schedules. We also have made changes regarding our field staff. Beginning Wednesday, county field staff will not be coming into the office and will work completely from the field. This, of course, is to limit our exposure of large crowds in our organizational settings. We have canceled all county-sponsored programming at library and park and recreation facilities, as well as our congregate senior nutrition sites will be closed effective Wednesday, and staff will be providing home meal delivery to those attendees who request it. These changes will continue to be monitored, and we will update you as necessary and as other changes will probably be made. We do appreciate the flexibility of our staff and their patience as we continue to ask them to think about business needs and operations in a different way. I want to stress to you and our staff that we are doing everything we can to be supportive of our staff and their families during this time, and we anticipate that there will be more changes to come. We are also mindful of our responsibility to manage the organization in a fiscally responsible way and have that in mind as we work through requests and ideas for change. We are asking from the board tonight for a couple of actions that we would ask you to add to your consent agenda. That first, is a personnel resolution change that includes three things. A is extended pay change leave, essential personnel definition, and the provision for the county manager to make changes that would allow for the safety of our workforce operations. And additionally, we are asking for the waiving of county procurement policies to adapt to emergency needs, and you have those items in front of you. We believe that these things will allow maximum flexibility on our proactive steps during this ever-changing situation. And additionally, we believe these employ best practices that we're seeing across the country at this time. Jason Kay is here to answer specific questions if you have them about those items. And again, we would ask that you add those to your consent agenda. And specifically, I just want to be very clear about what we're asking for in the extended paid leave. We have made this announcement to staff. We would be granting 2 weeks of extended paid leave to specifically cover situations related to COVID-19, and we have sent that information out to staff and their ability to use those 2 weeks during, again, this time of change in the community and in the environment that we're dealing with. One final item before I introduce our public health staff. Staff is also working to finalize an emergency declaration for the county. This would include all of our municipalities. We are waiting on, I think, one final town to have that completed, and we anticipate this would be finalized, and we would have the chairman sign that before the end of the day. And if there are any questions about those comments, we'd be glad to answer them. And then we're going to have Dennis Joyner, our public health director, and Dr. Steve Keener, our medical director, come and provide more specific public health updates. And Marvin just signed off, so we will get Commissioner Simpson, Chairman Simpson, to sign the emergency declaration as soon as we are finished with this meeting. Any questions before Dennis and Dr. Keener come up?
See now, carry on.
Mhm.
Good afternoon, Commissioners. I appreciate the opportunity to give you an update on COVID-19. I have to admit, I would rather be sitting over in my office than being here, but we are, as everyone knows, in unprecedented times in terms of the national response to a virus that we didn't know anything about as early as December of 2019. I want to give you a quick little picture of sort of where we are. All right, I'm hoping this will open. Currently, nationally, worldwide, there's 179 confirmed cases. This number is changing hourly, really. It's changing very, very quickly. And if you would have looked at this map about a week ago, you would have seen essentially the red dots around Seattle and Washington, Oregon, and in California. Over the past week, we've seen the spread across the United States, and that is the driver for all of the different steps that are being taken right now in terms of the new term of social distancing. Currently in North Carolina, there are 37 cases. There are no deaths at this time as a result of COVID-19. The spread has happened very, very quickly. And fortunately, at least still in North Carolina, there's a high relationship to travel association in that spread. One of the things that we're trying to look at is to what extent the spread permeates in our community and spreads in the community without a traveler kind of arrangement or contact. So that's one of the things that we're watching. Currently in the U.S., there are, where is the, I can't read the number, over 4,000 confirmed cases in the U.S. total. In North Carolina, before I came down here, my understanding is that the numbers now is up to 37 cases. That's just how quickly things are changing. Still no deaths in North Carolina. This is a map of the 33 cases where the cases occurred in North Carolina, the different counties. The closest ones that we around us are Mecklenburg and Cabarrus. Currently, right now, we do not have any cases in Union County. However, there have been cases pending, and we're awaiting results, and we'll continue to do that as testing gets ramped up. One of the terms you're hearing in the media is the term flattening the curve, and from an epidemiological perspective, it's a very important term because one of the things we're trying to do, if you leave a virus or some kind of outbreak unchecked, You're going to have some huge spikes when you get a lot of cases all at one time. Those spikes can put an unbelievably high, have a high impact on the healthcare system and the hospital setting. And so those folks who need care may not be able to get that care because of it can overwhelm the system. So what we're trying to do is to keep the number of cases down so that the healthcare system capacity can respond appropriately in addressing the virus. Because time is really, in some cases, our friend, but it needs to be dragged out. So with protective measures, and those are some of the things that you're seeing happen right now with reducing the number of gatherings, reducing a lot of events that's going on, social distancing, all of those kind of steps that are very commonplace in the lingo right now are all for a very real reason, and it's to help flatten the curve. One of the important things about COVID-19 too is that fortunately the mortality rate in general is less than some of the other coronaviruses that we've seen in the past. SARS and MERS were coronaviruses, types of coronaviruses that were we've seen in the past, but those mortality rates for those were considerably higher than what we're currently seeing now with COVID-19, which is around 3.4%. It's likely that that's going to reduce. It's going to probably drop over time as we see more and more cases come forth. I point this out because it does reiterate the fact that in general, roughly 80% of folks who would get COVID-19 are going to have pretty mild symptoms and often not require any kind of extensive medical intervention. And the types of response for them may be just basically staying at home in isolation and you just sort of wearing it out over a 14-day period. There's going to be a percentage, however, that will have more severe cases and can lead to pneumonia. And for folks who are in very, very sensitive health conditions with comorbidities and other complicating factors, it can actually create much, much more problems for them and can, as we've seen, lead to death. But I wanted to point this out because for the most part, the general public who would be exposed to in a healthy public is going to have a mild experience. In terms of how infectious SARS or COVID-19 is, it is in the line of flu and the previous SARS that we saw in years past, a couple decades ago. You would see, but it's nowhere near as infectious, even though it's spreading very, very quickly. It's still not as infectious as things such as measles or rubella or smallpox, which we have fortunately eradicated over the years. The symptoms of COVID-19 are fever, cough, and shortness of breath. Typically, these are very common respiratory symptoms we see with flu, common cold, so that's what makes it a little bit complicated because it does tend to blend into that mix of illnesses. There's two main elements that we try to implement from a public health standpoint, and that is containment and mitigation. Containment really is where we're focusing on isolated cases. We're trying to monitor those individuals for symptoms. We're trying to contain that virus through quarantine or isolation measures where we're actually going to try to restrict their movement and involvement with other population groups. We're going to do contact tracing where we're finding out who all of you been around closely in the last period of time during an infectious period so that we can check on what their symptoms may be and make sure they have a way to contact us to get testing and or care if they were to become ill. This may not prevent the spread, but it delays very, very valuable time for us to continue to prepare. Unfortunately, the containment level alone has not worked for COVID-19. as we're seeing, which means we've had to move into other mitigation levels. And those are the things such as environmental and community measures that you're seeing now with social distancing and the extensive promotion of hand hygiene, making sure we've got cleaning high contact surfaces and all those things that I always tell folks that our mom and daddy told us we ought to be doing when we were kids anyway. We're also providing guidance to providers on assessing risks and limiting the spread of illness through these other mitigation efforts. If we can get ahead of that with time, as you know, there's no vaccination for COVID-19. In essence, these mitigation factors that you're seeing come down from the feds and from the state, those are our vaccination measures in essence. That's what we have. I mean, it's not a vaccination, but that is the best we have. And it can have, in many ways, the same impact over time in terms of limiting the spread of the illness. You've seen these measures here very, very often. Washing hands, not touching your face, covering your cough and sneezes. A couple key points I want to make moving forward. Patience. This is going to take some time, so prepare for disruption. We're already seeing it. I want to point out as well that it's unsettling when you see the drastic steps that have been taken nationally and from the state perspective. It has an impact on everyone's mental health, particularly also many elderly. It's confusing when you see things closed and schools closed and those kind of actions. Try to be patient and be supportive and put this in perspective. The other thing is there's going to be guidance changes that likely are going to happen. Be patient with that as well. And I'll be honest, over the last couple days, my guidance and recommendations have vacillated. And so people are asking me, what should I do? And it's not that I don't know what to do, what to tell. It's like I'm trying to also gauge what that guidance is from a best practice perspective. So patience is important, and having some grace in understanding all of us who are trying to weather this. The other key thing I want to mention is when we get a case or cases, nothing is going to change in terms of how we are responding. From a public health perspective, we'll be doing some additional work around contact tracing efforts, but the prevention messages and the current efforts that we have in place now are going to continue. And so I don't want anyone to panic because, quite honestly, it is expected that we probably are going to see a case if this continues on the way that it is. It's difficult to predict. But in terms of what our response is, we're going to continue charting the course in that regard. I'll let Dr. Keener make some comments from the medical standpoint side.
Thank you. Good afternoon, Mr. Chairman, Commissioners. I'm Stephen Keener. I'm serving as a medical director here at the Health Department for a little over a year. I think Dennis has provided a really good summary of kind of what the situation is with respect to public health. And I'll just like to add a couple of comments about the medical aspects. Excuse me. So first of all, this is a respiratory disease, and it does cause the symptoms of fever over 100 degrees, cough, and shortness of breath, difficulty, catching your breath. A lot of people have asked, well, how is this different from flu? What's the difference between the disease caused by COVID-19 and the disease caused by influenza? And there's a couple of important differences. First of all, aside from being caused by different viruses, COVID-19 is a little bit more infectious than influenza, and you saw that with the little bubble diagram up on the screen. The other maybe more important factor is that all of us, by coming in contact with influenza year after year after year, have some built-up immunity in our bodies against influenza viruses. Now, we may not have immunity against a particular influenza virus, but all of us have immunity against many of the class of influenza viruses. COVID-19 is a new virus. It has come from a mutation that occurred in a coronavirus. And so our immune systems have absolutely no experience with this virus. So it is much more likely that when someone is infected with this virus, it's going to cause disease. As we know from our experience so far, that is much more likely to occur in older individuals, and particularly with individuals who have pre-existing disease, such as diabetes, lung disease, or heart disease. And also with people that have, for any reason, decreased immunity, whether that's caused by a disease or whether it's caused by the fact that somebody has had an organ transplant, or whether they're taking certain medications that weaken the immune system. So there are a lot of rheumatoid arthritis and some of the arthritic diseases that people take, medications that kind of weaken the immune system so that they don't have such a bad reaction to the inflammation. What is it that we should be doing or can be doing as individuals? Obviously, we feel some anxiety because of the uncertainty that's out there, and we want to do something. So I think the messages are, with respect to what we do, you saw them up on the screen, but they bear repeating. The most important one is washing your hands frequently. If you think about it, wash them. Make sure you wash them with warm water and soap, and you do it for at least 20 seconds. So sing your song, whatever it is. Make sure also when you wash, you get in between your fingers and around your fingernails, because that's where these things like to hide. Use of hand sanitizer that is at least 60% alcohol is also a very good strategy. In fact, some studies have shown that after you use hand sanitizer and you let it air dry on your hands, that it actually continues working for several hours. So that's a really good protection. We all like to exhibit good respiratory hygiene, which you know is coughing or sneezing into the crook of your elbow. A really big one is avoiding touching surfaces, which is why I'm holding my hands together here instead of putting them down here. And also very important, don't touch your face. This is how we get sick. It's because our hands, which are the way we sense the environment, touch surfaces, and then we touch our faces, probably about 50 times an hour on average. And I've tried to just, keep holding my hands together, and maybe it's praying too, I don't know. But that helps me remember not to touch my face. That's really important. With respect to our comings and goings, going outside in an area where you can kind of be alone or not close to other people is fine. You want to avoid touching other people, shaking hands. You want to try to stay out of people's personal space. 6 feet is the ideal, but if it can only be 3 feet, then 3 feet is better than 0 feet. It's a linear relationship. If you get sick with respiratory symptoms, that would be a fever that's over 100 degrees, cough, and shortness of breath. Make sure you call your doctor or wherever you're going to go, urgent care, emergency department, before you go, so that they can make the appropriate arrangements for receiving you and doing what they think is best in terms of your management. Most likely, a test for influenza will be done first, because if that is positive, then you are likely going to be diagnosed with influenza and not given a test for COVID-19. As you know, those tests are in short supply right now, so they are prioritized to those that have the highest likelihood of having COVID-19 infection. Also, it's important, and you will get these instructions from whoever your provider is, to isolate yourself at home. And what that means is just staying in the house. Hopefully, a family member or friend is able to provide you with the necessities that you need in terms of food and you know, things that make your isolation more comfortable or less uncomfortable. And try to avoid coming in contact with anybody else. The period of isolation depends on how long it takes you to get well. And I've heard some talk about actually doing a test after a person gets well to determine when they are no longer considered to be ill and when their isolation can be finished. I don't think that we are there in terms of having the adequate supply of tests at this point to do that. If you have been exposed to somebody that has COVID-19 and you are having symptoms, you will be isolated. If you have been exposed to somebody but you're not having symptoms, you will be quarantined, and that means you will just be kept separately to make sure you do not begin having symptoms. And if you make it through 14 days and you don't get sick, then you don't have it. If you have symptoms, then you would probably be tested after that. I'm going to stop and see if you have questions, either for me or for Mr. Joyner.
So did I understand that you no longer shed the virus or no longer contagious after the 14-day period? Is that correct?
No, I didn't mean to say that. If I did, let me make it clear. There are two different types of limitation of movement. One is called isolation, and one is called quarantine. Isolation is used to limit people's movement when they are sick, and the reason is because we do not want them out and about spreading the virus to other people. Quarantine is used when someone has been exposed to a sick person, but they themselves are not sick. And the purpose for limiting their movement is so that we can make sure that we know if they develop symptoms and become sick, and therefore limit their exposure to other people. So what I meant to say was, if someone is exposed and they do not develop symptoms, i.e. they don't get sick, they don't get disease, after 14 days, because that's 2 incubation periods, then scientifically it is so unlikely that they have acquired disease that they can then return to normal life.
You did that well. Maybe you didn't understand my question.
Okay.
I'm confirmed, let's just say I'm confirmed to have COVID-19.
Yes.
After 14 days, after I get well, after I'm feeling great, and after 14 days, do I no longer shed the virus to other people? Is that potential gone?
As far as I know, it is unclear how long the virus is shed. Whether it stops before the symptoms go away, when the symptoms go away, or after the symptoms go away, I don't think there's enough research that's been done to tell exactly when that is. What I meant to say was that when someone has recovered from COVID-19 illness, then I have heard talk that at that point a test would be used to determine whether or not the virus was present or not.
I see. Good. Thank you. Any other questions? Thank you very much. Takes us to our next item, which is informal comments. I see we have no one signed up to speak. And so that will take us to our additions, deletions, and adoption of the agenda. Commissioner Helms.
Yes, I'd like to ask item 20 of the consent agenda be removed for further discussion.
Okay. We also amended the agenda by moving up, and so 26 is no longer there, it was moved up. So we also have the items that Ms. Lancaster covered that we need to add to consent. So with those amendments, is there a motion to approve the adoption of the agenda as amended?
So moved.
You have a motion, all in favor say aye. Aye. Opposed, none. Motion to approve consent as amended. All in favor say aye. Aye. Opposed? Thank you. Let me find my place. Old business is next, and that comes right after 23 on consent, and we have no old business, so we will go to new business, which is item 24, the Union County 2050 Comprehensive Plan Update. I believe Mr. Morgan's got, Mr. Lee, Mr. Jensen, and Mr. Morgan going to share with some information.
Thank you, Mr. Chairman. Appreciate it, and members of the board and county manager. We've been working on this thing since December, actually. There are 6 subcommittees, as you may know, that with one coordinating committee, and I'm the chairman of that, so I get to meet with y'all about every quarter to let you know what we're working on. And like I said, we've met since December. All of our meetings are open to the public. We haven't had anyone that wanted to speak as of yet, but they are open to the public, and each committee allows some time for that. We've received information from some different departments, Public Works and Department of Transportation, Parks and Rec, and Economic Development, to try to give us an overview of where we are for a lot of us that aren't familiar with those type of things. So we're trying to bone up on that. How do I advance this, Lee? There you go. So here's our process, and you can see it. I'm gonna wear my glasses. Where we're at now, we're in the visioning phase, and we're into March. So we've got these, we've had these 3 community meetings that we've had so far. We're going to complete all this by the end of this year, 2020. We're in the first phase now, which is our visioning phase. Our next phase is developing alternate scenarios that'll support the adopted vision that we're working on now. The final phase will be development of a plan that implements the adopted scenario, and I'll be meeting with this board a couple more times along the way, just to make sure that we're on course and let you know where we're at and make sure we're headed in the right direction. But we're in the first phase right now of the process. There have been 4 draft vision statements that have been sent out for a public comment, and we're soliciting comments through the end of the month. A lot of people right now are obviously preoccupied with the news in our nation, but we're trying as best we can to get these people to fill out these online surveys. We've had 3 in-person meetings, Monday and Tuesday, Wednesday, 9th, 10th, and 11th in Mineral Springs Indian Trail and the Ag Center. We've had 38 folks show up, and we've got over 100 respondents, a little bit more than that now on the online survey, and we expect more by the end of March. There have been 4 statements presented to the public based on the input that we've received in these different 6 subcommittees in January and February. And there were 4 themes that we came up with: supporting municipalities, infrastructure focused, market-driven, and cooperative, were the 4 vision statements we came up with. And you can see there on your screen the different ones, so I'll give you time to look at that. Municipalities finds Union County a place defined with vibrant municipal cores, clearly designated commercial and employment nodes, a range of housing types, and protected rural and ag character. Residents and employers in the county can expect clear boundaries between these municipalities under this plan, consistent guidance on where the new growth will be supported, upgraded arterial corridors between the activity centers, awareness and support of the agricultural activities in the rural parts of our county, a range of employment and development opportunities in the areas that are well served by our infrastructure, and alternatives to driving in the municipal cores. And some of the observations from the municipalities part, it of course supports municipalities. It may require extending water and sewer service to serve some targeted growth areas. That would be a financial hardship for Union County Public Works. It may require more concerted effort from municipalities to guide this growth. It would rely on RA 40 zoning that may not result in agricultural protection. The opportunity to improve downtowns would be in the municipal plan. It would reduce growth in the rural areas. The municipal ability to implement their own goals and visions, but it may result in less commercial and employment if not supported by municipal plans. And it may increase traffic impacts if growth patterns are counter to the transportation network improvements. And you know, transportation is on a lot of people's minds right now as it is. The infrastructure plan sees Union County defined by efficiently provided services and limited development where capacity is not present, and deliberate consideration of where to expand our capacity. Residents and employers in the county can expect the lowest possible utility rates because of that, upgraded arterial corridors where utilities are present, a range of land uses, growth, higher density where utilities are presented and can handle it, preserved and well-defined rural areas, and convenient accessibility between retail, residential, and employment land uses. Under the infrastructure plan, it would utilize the maximum efficiency for water, sewer, and transportation systems, which would be good. Reduce development in rural areas. It may blur some lines between municipalities in the western part of the county. Does not support extensions of utilities for prospective development. Ability to control location and high-density growth. Clear priorities for road widening projects. It may conflict, though, with municipal visions or citizen sentiments about growth, and it may require additional local funds to implement road widenings in an acceptable time frame. It also requires defining developments that fall outside of the prescribed criteria. That's infrastructure. Market-driven, that's a place in Union County defined by a range of different housing types, increased commercial options, predictable development process. Residents and employers in the county would expect, under this plan, increased housing options in areas where people want to live, a market-driven range of land uses, convenient accessibility between retail, residential, and employment land uses, increased employment opportunities like office and industrial development, and a more streamlined development process. But the observations under the market-driven plan, it reflects market demands for housing type and location, opportunity for cooperative partnerships with developers to address infrastructure issues in areas that are of high demand. It may impact an excessive number of roads, does not achieve coordination goals of visioning input, increased tax base due to non-residential development, increased potential for landowners to sell their land. It may result in more sprawling development patterns into rural areas, and also may undermine municipal plans and increase conflict with the county. It requires resisting area resident opposition to new development where it's proposed. That's market-driven. And then finally, cooperative. Union County in 2050 under the cooperative plan is defined by connections where local governments work together. Travel between these places is safe and reliable, and developed areas work together. Residents and employers in the county under the cooperative plan can expect walking and bicycle connections between activity nodes, retail and employment options in designated areas throughout the county, increased capacity to address stormwater and other multi-jurisdictional issues, preserved and well-defined rural areas, convenient accessibility between retail, residential, and employment land uses, consistent aesthetics along the corridors, enhanced community connections for arts and ag and recreation, and increased opportunities for community events and initiatives. But some of the observations under the cooperative plan, it meets the vision input of coordinated efforts, increased capacity and commitment to meet the collective challenges like stormwater, environmental stewardship, and walking networks, increased recreation opportunities, May require increased taxes, though, to pay for programs and initiatives, transportation alternatives in the urbanizing areas. It can also shorten the average trip length. It requires cooperation and blending of multiple local governments' visions, and it requires sustained commitment as well from these different municipalities. So cooperative and then infrastructure are the preferred visions when we sent out these surveys. This is what we heard back. Infrastructure is seen as slightly more feasible. Residents really didn't like the market-driven vision at all. The demographics of the respondents, as you can see, half of them are between 30 and 45 years old, and more than half live in the 28104 area code. What did we just say? Stallings, that's the Stallings area, and Waxhaw Weddington 28173. 1/5 have lived here less than 5 years, and 1/3 of the respondents have lived here for more than 20 years, just to give you an idea. So coming up next, in April, we will approve a vision and review the scenario development input. And then in May, we will refine these scenarios. In June, we'll approve scenarios for public comment, and then in July, there'll be public comment on scenarios that support the approved vision that we come up with. And like I said, we'll be meeting with you 2 more times between now and then. So anyone have any questions so far? We're just getting this thing started, and we hope to get some more respondents from the online survey.
Thank you, Archie. Commissioner Rape has a question.
It's not a question. I want to brag on you a little bit, so just take it and
Just stand here and take it.
stand there and take it.
Yes, sir.
You're one of those natives of Union County that's been here your whole life, and I'm so proud to know you, so proud that we have you. I know in dealing with planning, as I've learned in public service, you learn so much about the behind the scenes. You're just a true asset to the community, and you know, you've really got a voice that should be on radio. So thank you, Archie.
Well, I appreciate that very much. Just as an aside, I know things are changing hourly as far as the COVID-19 is concerned, and other states are doing different things. And I just want you to know that my radio station stands at the ready. Whatever we need to announce, or any of you see the need to come on and address our listeners, the door is open. It's open opportunity to do just that. And we'd like to hear from some of the different people in environmental health and so forth. Let us know what's going on. We just don't want there to be a panic. So the more information you give people, the easier it seems they take it.
Absolutely. Thank you, Archie.
Thank you very much.
Next item is our critical intersection analysis, design, and cost estimate update.
Oh, they all went away. Well, you get to see me Google in real time. Thank you, Mr. Chairman, members of the board. I am here to give an update on the critical intersection program, which you have authorized us to update in 2019. We are currently in the public comment phase for a series of 6 intersections that we have received funding through the Charlotte Regional Transportation Planning Organization to go out and use consultants to develop alternate designs for 6 locations throughout the county that I'm going to bring up in a moment, and to also develop cost estimates for those alternatives, take them out for public comment, which we're doing right now, and then come back and, with the municipalities that are affected by these intersections, approve a preferred design for these locations. And so I'm going to Google pretty quickly. We have a really good outreach tool that we've used for each of the 6 locations, and these are the 6 intersections that we're currently reviewing. 2 are in Waxhaw, 1675 in Waxhaw, 75 in Old Providence in Waxhaw. You put $100,000 in cooperation with the town of Waxhaw at this Old Providence intersection, which was funded by CARTPO in February. Forest Lawn and Potter in Weddington, Lawyers in Stevens Mill and Stallings, Old Camden and Morgan Mill in Unionville, and Sutherland and Walkup in Monroe. I'm going to pull up just one intersection as an example of how we're allowing the public online to get every bit as much information as they would if by going to an in-person meeting. So first tab on this page is an overview of the intersection and the issue. You have contact information from the town of Waxhaw as well as myself, and you have a map that shows where it's located. You go to tab 1 and you see the alternate. Number 1 alternate is a roundabout. I'm not saying it's the number 1, but it's the first alternate. And you can click in here and get information like showing there's a sidewalk, that this T intersection would extend to the north to allow the gas station and the church to have access, that there would be a left-hand turn lane into this gas station. So a lot of information shown for this one design. Then you go to the second one, exact same location, just shows the alternate design with a lot more information about this specific one, which is signalizing it and adding turn lanes as opposed to a roundabout. So these two alternate designs were evaluated with the NCDOT, with the county, with the town, and were seen to be feasible and acceptable, and so they went out to public comment. And then how we're soliciting comment is you have a comparison of the alternatives, including the costs, talks about delay, crash rates, some qualitative aspects of the projects, and then the survey down here where it's asking information about where you live, your age group, how long you've lived here, which alternative, and then what you like about it. So we have 6 locations throughout the county. Here at 1675 in downtown Waxhaw, it's essentially a pedestrian versus a traffic-oriented perspective. More turn lanes versus fewer turn lanes. 75 in Old Providence, roundabout versus signalization. Forest Lawn and Potter, roundabout versus signalization. Lawyers and Stevens Mill, more turn lanes versus some reduced access on a fourth leg to that intersection to improve the signal operations. Old Camden and Morgan Mill, it's a 4-way stop versus a roundabout. And then Sutherland and Walkup is turn lanes versus a roundabout. And in all 4 instances where the roundabout is being proposed, that is the preferred alternative based on citizen input. So what's going to happen next is, since all 6 of these are within a municipality, they're going to go to their town boards for some sort of vote, ideally to choose a design. We could take it back to the county commission for feedback as well. Presumably we would support what the municipalities want, but we can take it back to you in May when those designs are firmed up based on community feedback, and then in June this report will be complete and we will have 6 intersections that have been evaluated with a locally preferred design, estimates of the benefits of them, as well as a cost estimate for that design, which we can then use to take off the shelf and apply for grant opportunities as they're available. I'm happy to answer any questions you may have.
Commissioner Ray?
I have been able to work with Bjorn on this CARPO as I'm the commission representative, and he has been one of the best wingmen that I could ever ask for. He gives me the targets and I try to attack them. I believe you're chairman of the TCC.
Vice Chairman.
Vice Chairman. It's been an eye-opening experience for me. There was some talk about we weren't pursuing our public transportation money. Well, Bjorn, you can tell everybody we have, hadn't we? And I believe we got it put on the agenda based on the survey that we heard last fall that we were missing out on money.
Well, we're actively working on it, yes.
He's a good target identifier. He tells you how to handle it, and so far it's been very effective, and we're moving stuff up the agenda and getting them to talk about it. So I used to didn't know what you do, but now I very well understand.
Job security is nice, thank you.
Thank you, Bjorn.
Thank you.
And it takes us to fire funding district implementation.
Thank you, Commissioners. I want to give you a brief update on the last few months and then kind of the next steps on implementing some of these new fire tax districts. On November 18th, 2019, the board made the determination that the urban-rural model was the preferred method at that time. The urban-rural model is a 20% subsidy to urban tax districts and a 40% subsidy to more rural tax districts. The determining factor for urban or rural was $1 billion tax base. Just want to go over the list of the current fee districts that would be moving to a tax district. Allen's Crossroad, Bakers, Beaver Lane, Fairview, Griffith Road, Jackson, Lanes Creek, New Salem, Providence, Sandy Ridge, Stack Road, Unionville, and Wingate. In addition to those fee districts, we also have been trying to gain municipal support for the Hemby Bridge fire tax district. There are certain properties that are currently not paying a fee or a tax, and in order to capture those properties, we need to overlay a new tax districts to capture that. Over the last several months, we have been reaching out to municipalities. Any municipal limits that is in one of these new proposed districts needs municipal support. So far, Wingate, Marshville, Fairview, Unionville, Indian Trail, Stallings, Lake Park, and Wesley Chapel have approved those municipal resolutions. They have given us consent to collect that fire tax. Hemby Bridge is the only one that hasn't. They were supposed to do it in February, and they did not have a quorum. I talked to the mayor there today, and they are going to vote on that on this Thursday. The document that you have in front of you is a resolution. It's a statutory requirement to set a public hearing to give the public a chance to comment on the formation of these tax districts. That public hearing will be set for May 4th. In addition to setting that public hearing, there's a few things that I'm going to read from this resolution. The board acknowledged that it has received the statutory information for its consideration in determining whether to establish the proposed service districts. The board directs county staff to prepare a report for each proposed service district, which may be in a form substantially similar to the attached reports, and make each report available in the office of the clerk of the board for at least 4 weeks before the date of the public hearing. The board establishes the date of the public hearing regarding the proposed service district as May 4th, 2020, and directs the clerk of the board to publish notice as such required by this act. Pursuant to the act, the property taxes within each proposed service district may not be levied in excess of a rate of 15 cents on each $100 of property subjects to taxation. So the process we are going with for these would limit the rate that could be levied in these fire tax districts to 15 cents. It is not anticipated that any of those districts would have anywhere close to those tax rates, but if we did at some point feel the need to go above that, there would have to be an additional process to go above that 15 cents. So that is essentially what you're passing today, is a resolution to just set that public hearing for May 4th. It does not vote on fire department budget. It does not actually implement the tax districts. It just sets up that public hearing. So with that, I can answer any questions you all may have.
Mr. Helms?
If I recall, in the existing tax districts, that 15 cents is in the plan right now. I mean, it's not a new thing.
I believe you're correct, but I'd have to go back and research that.
Further questions? So Patrick, you need a motion to adopt the resolution regarding the process for establishment of certain service tax districts for the purpose of providing fire and rescue services, and set the public hearing for May 4th.
Yes, sir.
I make that motion. Any discussion? Hearing none, all in favor say aye. Aye. Opposed?
Thank you.
Thank you, sir. Takes us to the county manager's comments.
Thank you, Mr. Chairman. Since our last meeting, Union County government and our community has experienced a series of extraordinary and unprecedented events and challenges You've heard about two of those already this evening. The one that the sheriff mentioned with the water break, which tested our ability to get out early in the morning and take care of business. And then the COVID-19 virus that continues to change and evolve on a seemingly hourly basis. One other one that I would like to address this evening with you is last week ended with the largest disruption to a public water supply, to our public water supply customers, and one of the largest emergency operation activations ever experienced by Union County. This event tested our capabilities and it stretched our resources. It confirmed areas of operational strength and quickly exposed dated utility processes and technology that were found to be insufficient for processing timely system-wide mass customer notifications. The capability of our proprietary servers that hosted the county's main web presence were unable to function after encountering the largest amount of sustained web page traffic ever experienced by our system. The servers eventually recovered, but only after valuable notification time had been lost. This event pushed these two vital resources beyond the limit of any previous use, and in doing so exposed vulnerabilities that required immediate intervention. And we've taken the following steps to limit any repeat of this experience. The data necessary for processing timely system-wide mass customer notifications has been migrated to the Everbridge mass communication platform. It has the capacity and the capability of pushing out instant notifications across the entire utility customer base using multiple communication channels. In addition, the county's main web presence has been successfully migrated from the proprietary site servers to cloud-based servers that have exponentially more capacity and more capability for maintaining our web presence during periods of rapid increases in web traffic and sustained high volume web traffic without going dark or reducing the speed of information flow. The North Carolina Department of Environmental Quality's Division of Water Resources regulates all public water providers in the state. NCDEQ provides regulations regarding the water test sampling process and the parameters for acceptable levels of various elements that may appear in the public water system. When the level of a specific element exceeds the maximum level set by DEQ and is then confirmed by a secondary sampling, then DEQ requires the public water system to provide a system-wide boil water notice to affected customers of the system within 24 hours of NCDEQ's direction to the system provider. In this case, last week, a routine water sample was taken at a very specific site that tested positive for E. coli. Per the protocol, secondary samples were taken at the original site and on either side of the site. The original sample site tested negative on the second sample. However, two secondary samples taken on the upstream side of the original sample tested positive for total coliform. Based on these results, NCDEQ ruled that the E. coli sample was valid and therefore a system-wide boiled water notice was required. Once NCDEQ required a system-wide boiled water notice, other state agencies were notified by NCDEQ, and they began providing directives to our local environmental health staff and county officials regarding requirements to limit public food production and certain other public service facilities. The timing of our initial notifications has been questioned. Staff received the NCDEQ notification related to the utility system-wide boiled water advisory at approximately 10 p.m. on Wednesday, March the 11th. Union County began receiving specific directives from North Carolina Department of Health and Human Services Environmental Health Division before 5:00 a.m. on Thursday, March the 12th. Within the first hour of receiving those directives, county officials were in contact with community partners to inform them of the health safety directives issued by the state of North Carolina. Because of the timing of school opening, the Union County Public School System issued its statement to close schools within an hour of being notified by the county. The County Emergency Operations Center was opened shortly thereafter, and public communications were drafted, and the process of customer notification began. The testing zone around the initial positive test site was expanded, and over 20 additional water samples were taken on Thursday. All of these water samples returned negative results on Friday, March the 13th. There's strong evidence that this event was localized to a small area of the public water system, and there was no widespread contamination of the public water supply. We readily acknowledge the sequencing of school and county notifications was not preferred. However, given the timing of directives to the county from the state and the scope of impact to the public school system alone, the release of public notification by Union County Public Schools ahead of notifications from Union County Public Works was warranted. We readily acknowledge the insufficiency of processes and technology to facilitate timely notifications and provide real-time information during the beginning hours of this event. To those inconvenienced and otherwise impacted by the delayed notifications, we sincerely apologize to you and are resolved to correct these processes and systems that contributed to our not meeting your expectation. In closing, I would like to pay a special thank you to the City of Monroe for assisting us and partnering with us, providing a secondary water lab and a secondary source of water sample testing. Also to our employees in the environmental health department here in food and lodging who were tasked with the responsibility of contacting all food providers in the county, along with daycares and other care facilities, healthcare facilities, and notifying them of their responsibilities under the directives of the state of North Carolina. With that, Mr. Chairman, I have no other comments.
Thank you, Mr. Manager. Commissioner Akins.
I have no comments this evening.
Commissioner Rushing.
Thank you, Mr. Chairman. Many of you don't know that since I was a young child, I've worked around animal. We grew up on a poultry farm. We had, when we walked in and out of the doors, we had dip pans and we had biosecurity. For 15 years, I worked in an industry where I had to take a shower to go work with the animals. I had to shower in and shower out. I would take up to maybe 10 showers a day sometimes. My job included breeding stock selection for that company, and I was basically in charge of making sure that those animals were moved in a healthy and proper way. We found disease on farms, and from one day to the next, you could see as many 80% of the animals infected because they're all in tight quarters. So a lot of people have been concerned about the governor's edict and churches being asked not to meet and asked not to meet in large groups. There is a reason behind it, and I know that a lot of people don't trust government, But this is something that's very important, that the spread of this disease, because it's new, like we were told, can be quite severe. Again, I've had to treat animals, thousands, in just a matter of days. Our hospitals would be overloaded. Our resources would be stressed. And I for surely don't want to be one of the people that's responsible for an elderly person not having a respirator and going through that disease. There's only so much resources to go around. So please listen for the next couple of weeks. It wouldn't be, it's not a joke. It's not something that the government's testing out. It's not a trial balloon. This is something that we really need to take seriously, and we need to make sure that the elderly population and the people that are susceptible to get this and pass away, that they're protected. The folks that are sitting in the audience, I don't know if anybody's watching the audience, but there's a lot fewer chairs tonight. They're spaced apart. This is not a show. This is a serious thing. And trust me, I've got people in my own family, my own wife, I'm fighting her every day about this. She don't want to believe it. But believe it and understand that just because not as many people die from it as die from the flu, that doesn't mean it's not dangerous. And the steps that we're taking right now, like was said, this is an inoculation almost. It's a way of stopping the disease, hopefully, and limiting the effect that it has. So please take serious what's going on. Please keep your eyes on the news. There's going to be a lot of politics played with this, but this is not a political game. This is something that is going to be devastating for a few weeks, but it could be worse. And hopefully we come out on the other side of this and say, hey, it wasn't that bad. And everybody can criticize government for it not being that bad. But without the steps that are being taken today, I've seen it firsthand in animals be a lot worse. So with that, I wish everybody good night.
Mr. Helms.
Yes, as the manager described just a minute ago, I think we need to, I want to personally thank the manager, the executive staff, and our utilities department, because they've clearly been baptized in fire in the past week or so, and they have addressed the issues like the sheriff mentioned. That was a severe situation that we had there, but they learned where their strengths and weaknesses were, and as the manager described just a minute ago, have already made a lot of the corrections that you never know. I mean, my background is IBM, and sometimes you don't know what a system does when it overloads. Well, we found out when ours got overloaded. But he's already resolved that with his staff, and I want to thank you very much for doing that. Also, Archie, I'll tell you, I've spoken to a lot of the participants in your committees. They're very complimentary of your process and your leadership, and we look forward to hearing the results of what y'all get. It'd be nice for one person to say what has to be for everybody, but listen to our community, I think, is very important, and for this county to move forward. And that's all. Thank you.
Commissioner Rape.
Well, I hate to be a mood killer, but I've been going to bring this speech up here, and I waited and waited and waited, and maybe should have delivered it earlier. But Commissioner Rushing should know about people having a distrust for government, because he's been a very good person on Facebook of telling how we don't know how to do our job. So I went back and took his post, and his post only, and I just want to read a few of them to you and then give you my comments. And I apologize for this, but somebody has got to address this issue. On December the 9th, he said to Union County citizens, "I would like to apologize to those who I asked to vote for Dennis Rape last year. Dennis Rape was elected on a platform of working to provide safe drinking water to current residents of Union County, and he's turned his back on that commitment. Today, I gave Vice Chairman Rape the opportunity to take back his support of a 33% increase in utility rates. This increase will only fund half of an almost $1 billion plan presented by the Union County Public Works. Vice Chairman Rape has proven time and time again on the BOE and BOCC he is incapable of staying out of compromising situations and in need of constant supervision. And then he goes on to tell about my situation with my certificate of occupancy, which was resolved before he printed this. And I just want to address this. He further asked me to recuse my vote, rescind myself. Stoney, what you have failed to do in the above post is accept the fact that you committed a felony when you told me that if I did not change my vote on the Yadkin Regional Project, that you intended to extort me by trying to slander my name and releasing the issue of my personal residence certificate of occupancy. Extortion is a felony, and if you are found guilty in a court of law, it would result in you being removed from the office of County Commissioner. This revelation by me of the events that occurred out here in the plaza when we were taking pictures, you then verbally expressed that to two other credible people before you did it on Facebook. You accused me of putting myself in compromising situations. Stoney, your whole life is compromising situations. NRA problems, missing guns, overcharging of transfer fees, the list goes on. Then on November the 15th, after we had the Public Works workshop where Public Works rolled out this Yadkin plan, you said, would you support a bond for over $900 million to make way for more growth in Western Union County? That's what we were asked to do without voter input this week, along with a 15.5% utility rate this year and next year. And you go on to say, I will not be voting for it. Then on December 9th, in an attempt to distort the facts, you said that I committed to vote against a 15.5% increase in rates, committed to support extending water lines throughout the county, and instead I read the motion written by staff to more than double the increase to 33%. All of this while knowing that $1 billion could more than provide clean drinking water to every current home on a well in Union County. The 33% increase was not even mentioned by our staff till the night that Vice Chairman Rate made the motion to raise the rates. Well, Stoney, you talked about the rate increase on November the 15th. Then he went on to ask me to rescind it again. Stoney, you seemed confused and disoriented to me on November the 15th. You spoke on social media about that. Then on December the 9th, you said that's the first time you ever heard about it. And as far as commitment to people with water, we have authorized funding for 171 residents that possibly could connect to 655 houses, $5 million a year for a total of about $12 million. And we voted on that. Then you talk about piping water as far away from Lake Tillery to Union County, how expensive it is. The pipeline distance from Lake Tillery to our plant is shorter than the pipeline from Alligator to where we would have to put it to tap into our system, let alone bringing water that would not mix with the water we have due to chloramine versus chlorine. And you always end your statements, and so on and so on. That does not make it fact. You have done this your entire political career, and I, for one, am calling you out for this embarrassing and untruthful attack on management, staff, and sitting board commissioners on this board. You do not know more than the four other commissioners up here who have spent their entire lives in different professional careers. I would like to point out to you, too, something that you have yet to learn about public service. There is no I in team. you continually assume and broadcast that your way of management is the only way, and the rest of this board has no voice in county policy. It's called a vote. On March 13th, you posted about the please say a prayer. The county manager has chastised me for posting about this issue and claims that USDA is unhappy with me. My background in the importance of disease prevention in both animal agriculture and wildlife gives me great concern with the economic importance of poultry, and you went on to try to assure the county that you were looking out for them. I'm gonna tell you what's stupid. Being informed of a very fluid situation by our manager and being asked to not release this information until it's verified by USDA. In fact, we were all told that USDA would handle all of this public information. But no, you had to jump up on your soapbox and be the first out the gate. You demonstrated a desire for attention from the public as being their protector in chief and the appointed one of this board to speak for the county. You also failed to tell the public of your calls from higher officials in Raleigh who talked about your reckless disregard for releasing this information. Since you show no regard for other people's feelings or the truth, I'm also going to turn in today public domain, the court transcripts that were sent to us in the last few months about your court situation. I stood up for you, Stoney. I stood at polling places for the congressional race, and I vouch for you. And after you read these transcripts, it was all a lie. I'm sorry to do this here, but I think we have a great staff, a great management team, and I can forgive you if you could just think about what you do.
As the manager talked about some details regarding the weekend, he shared that information with me, and you would think that the COVID-19 situation was like drinking from a fire hose. Well, add a E. coli water scare and avian influenza scare, and three in a row, that's a pretty big mouthful regardless to take on. I received numerous emails on Friday morning as a result of the boil water advisory, which is not unusual. They do that on occasion. And also read a number of comments on Facebook. So if I could have you set just a few more seconds, I'd like to make a few comments as chairman and respond to some of those comments that I received via email. I could not answer them all, so I'll do it in public if that's okay. When I think about what I wanted to share, I'm reminded of that scene in Forrest Gump. Gump was on a southwest highway, if you've seen the movie, and he's running. He tells you how long he ran, 14 months and 6 days and all that, if you've seen the movie. It's right comical. But he was on that highway running, and he's being followed by a crowd of people. And he suddenly stops and turns around, and someone in the crowd says, "Quiet, quiet, he's going to say something." That's how I feel right now. He's going to say something. I was talking with Ms. Lancaster earlier today and remarked that America has been somewhat isolated for a long time. We have had some minor crises. We might have thought they were major crises at the time, but probably not since World War II or the Great Depression have we experienced anything of this proportion. Now, in my former life as an adult educator, I was introduced to Maslow and his needs hierarchy. You're probably familiar with that. It's often illustrated with a pyramid, and the base of the pyramid is formed first by physiological needs, things like food and water and shelter, and then by safety needs, such as personal security and health. So it is in our human nature and a normal reaction to strike out question or become fearful of anything or anyone that threatens our access to these needs being met. When I was elected in 2010, my first commitment was to the health and public safety of our citizens, and that commitment has not wavered. So to those of you who may have believed that your health or safety has been jeopardized in recent days, I apologize. The manager has described these events and has taken responsibility for shortcomings or failures in our processes or systems that occurred. As you heard, once aware of these shortcomings, we have moved rapidly to correct them. I have full confidence in our administrative team and believe they operated quickly and appropriately to the many challenges they have been presented with. If you saw the movie, you'll remember that Forrest stood for a few minutes staring at the crowd and then said, "I'm pretty tired. I think I'll go home now." Well, many of our employees do not have that luxury. They were here on Sunday morning for several hours. They're here 24/7 if necessary, seeking to ensure that these protections are in place. Despite how far we've come, we are still a human system, regulated by human decisions, which are often required to be made in real time and with limited information. As this portion of the meeting is for personal comments from individual commissioners, I'm going to assume that the laws regarding separation of church and state do not apply. So if I offend you, so be it. The Apostle Paul reminds us in Galatians 6:3, "For if any person thinks himself to be somebody, too important to condescend to shouldering another's load, when he is nobody of superiority except in his own estimation, he deceives and deludes himself." So for all of you armchair quarterbacks out there and self-appointed political pundits, take a lesson from Stephen Covey and the 7 Habits if you want to be effective. Seek first to understand, then to be understood. As Forrest begins his way back home, parting the group of people in the road, one person in the group is heard to say, "Now what are we supposed to do?" Paul reminds us, "Bear one another's burdens. Clothe yourself with compassion, kindness, humility, gentleness, and patience." We as a community, a state, and a nation are facing some significant challenges ahead. We are much more likely to be successful if we all pull together. This time I'll move that the board go into closed session for the following purposes: to discuss matters relating to the location or expansion of industries or other businesses, including agreement on a tentative list of economic development incentives in accordance with General Statute 143-318-11A4, and to consult with an attorney in order to preserve the attorney-client privilege, and to consider and give instructions to an attorney in accordance with General Statute 143-318-11A3. All in favor say aye. Aye. Opposed, none.